or feel a little bit stiff or shaky. And, they were said, well, just come back in a year, but now we actually know there's a lot of value in diagnosing Parkinson's earlier and treating it earlier. There's actually studies that show patients who are treated with something earlier on have better self-reported health status. So basically, patients are living longer, they're being diagnosed earlier, and then there's probably more environmental factors that we're just not aware of that, continue to accumulate to cause Parkinson's disease. So again, it's a chronic progressive movement disorder, about 1 million cases right now, but that number is definitely going to increase, hence why there is such a need for further treatments, and there's such a need for new treatments, and there's such a need for more awareness in the Parkinson's space. So I think, just even coming here today is really terrific, and I commend all of you for that. So, a lot of my patients will say, well, how did I get Parkinson's disease? I don't have anyone in my family that has it. I don't, what is the cause? So we still don't know, but we believe that it's potentially what we call a two-hit theory. So there's a blend of genetic factors and environmental causes that kind of cascade into each other to start the causative factors of Parkinson's disease. So true genetic Parkinson's it's rare. It's less than 10% of the cases, and usually those are in the younger patients. But we do have more than 15 or 20 genes that have been identified, and gene therapy is available if patients want to go that route. But we think it's maybe having a genetic predisposition, like you might be predisposed to having Parkinson's, and then something in the environment comes along and sets it into play. So things like rural living, exposure to well water, pesticides, herbicides, these things have been implicated in the development of Parkinson's disease. But again, we still don't have a single environmental cause. And aging, that's kind of the largest risk factor. So as patients age, the incidence and of developing Parkinson's continues to go up. So it's probably a blend of genetics and environment. And what is Parkinson's? So as Dr. Denisi talked about in his talk, it's very much about dopamine. So we have, dopamine is the chemical in our brain. It's a transmitter that basically helps us control our movement. It's why we can, grab a pen or grab a cup of coffee and not have, problems with tremors or with stiffness or slowness. And in Parkinson's patients, the neurons that produce dopamine, essentially they degenerate. And because of this leads to difficulty with controlling movement. So as Dr. Denisi mentioned in his talk, many of our therapies right now are focused in on the dopamine system, including levodopa, which is kind of our gold standard drug. But the key really is how can we promote more dopamine in the brain? So I'm not going to talk really all about meds, but I'm going to give you lifestyle tips to basically be able to promote your own dopamine. And so it's very interesting in that we think that Parkinson's, actually we know that it starts in the lower brainstem. So the lower brainstem area, and then basically it continues to progress. And by the time it hits this middle area, that's called the substantia nigra, that's when patients are diagnosed. That's when the tremors come out and the rigidity and the movement and the posture. But it's very interesting, we know that prior to that, when you have involvement of this lower brainstem, there's symptoms that develop even if patients don't have Parkinson's. So these are what we call premotor symptoms. So some of the big ones are loss of smell, constipation, anxiety and depression, and even things like yelling in your sleep and talking in your sleep and vivid dreams. Those actually can occur prior to the development of Parkinson's, which occurs right here. So we know that dopamine is being lost even earlier on in the course of the disease. So by the time someone's diagnosed with Parkinson's disease, it's thought that about 50 to 70% of their dopamine neurons have already been lost. So the key is really not to wait here until you're treated, but how can we promote lifestyle measures that when you're down there, you can really try to make sure that you enhance and save as much dopamine as you can. And then this is again the hypothesis that it starts in this lower brainstem. By the time it hits this area, the Parkinson's starts, but we know that Parkinson's continues to progress to involve much of the cortex, which is the outer kind of spongy regions of the brain, and the subcortex. And this is really where thoughts are made and where we think and how we act. And so that, it's very important that even if you're diagnosed here, how can we prevent, or slow the progression of, further involvement. And there's no drug that's available right now that will slow the progression, but I firmly believe that through lifestyle measures, you may be able to modify the disease in some ways. So signs and symptoms of Parkinson's. In order to make a diagnosis of Parkinson's, it's very clinical. As Dr. Janisi mentioned, there's no real utility for imaging or things like that. This is why I love being a movement disorder specialist, just because you really have to know your patients, and you have to make sure that that you really are evaluating them very comprehensively. So, there's a lot of misinformation out there that all patients with Parkinson's have a tremor. In fact, that's not true. I have many, many, many patients who are don't have tremor. So you don't have to have tremor to have Parkinson's. But one thing is the slowness or the bradykinesia. That's kind of when, in the office you're doing your finger taps and things like that. That's our way of looking to see speed of movement. So that's usually present. Stiffness is a big one. Balance can be affected, especially in the later stages. And it's very, very important to realize that there is no two people that are alike. There's no two people in this room or in our practices or in the state or really in the country that are alike in regards to the Parkinson's. Every single patient is so different. Hence why I think it's very important to be evaluated by a movement disorder specialist who kind of understands that. There's no paradigm here. There's not that you start drug A and you go to drug B and C. Every single patient is different, and you have to really weigh out, a patient's symptoms as well as, their comorbidities, as well as psychosocial factors and things like to really come up with an individualized treatment paradigm for each of your patients. And so this is why, in the context of Parkinson's disease, I can't stress enough having a good team around you, which we'll talk about, and having good open communication with your clinician. It makes a big, big difference in how you do, essentially. Some of the other symptoms, we're all guilty, especially in this day and age, of hunching down, right? We're all kind of like, whether you're on your phone or this is just our posture. One of the big things I'm a big proponent of for my patients is get that posture up, right? Shoulders back, neck up. Really work on the posture, because when that starts to become affected and is not corrected, that's when you start to see more of a decline. So again, something you can modify. 9 out of 10 patients tell me, when we do our initial intake, I ask, part of our scales are, how is your handwriting? And they say, oh, I stopped writing, I don't write anymore, it's awful. But I'm a big believer, and this is, again, how much you put into your disease. I tell all my patients to get one of those pads, like the kids learn to write on. I have a second grader at home, so like one of those really kind of big ones. And write big, 10 minutes a day. It's amazing. You'll get your handwriting back. So again, these are things that you can really work on from a lifestyle perspective. Cramping can often occur, shuffling, walk. There's so many different symptoms that go along with Parkinson's disease that are important to realize. And if you can correct them, it's very important. I'm a big believer in addressing non-motor symptoms. These are actually been shown to be more disabling than motor symptoms, but it's amazing that many patients are not even aware that non-motor symptoms are part of the Parkinson's complex, and so they're not always brought up. So some of the big ones are sleep issues. So you really are, it's very, very hard to treat a patient effectively with Parkinson's disease if their sleep is poor. And patients do have poor sleep in Parkinson's. They have something called sleep fragmentation, where they go to sleep okay, but then they're up every couple hours, and then they're up again, and that's called fragmented sleep. And that's a big issue, because you're really cycling and you're not getting that sleep. When we sleep, we have these little janitors in our brain. They come and they scrub all the oxidants and the toxins out, and you make lots of dopamine and things like that when you sleep well. So if you're not sleeping well, it's a big problem. And I tell all my patients sometimes there's no point in just increasing your meds during the day or changing things like that if sleep is affected. So sleep is really, really important. There's also things like the REM behavioral disorder, which is thrashing in your sleep, yelling in your sleep, vivid dreams. So it's not just quantity, but it's also quality of sleep. So I'm a big proponent of having my patients keep sleep diaries and things like that until we can address sleep properly. But sleep is very, very big. Constipation can occur. Again, another thing that, as well as low blood pressure on standing or lightheadedness. Another thing we're all guilty of, I think, is not drinking enough water. But in the Parkinson spectrum, it's very, very, very important to stay hydrated. Many of these patients are prone to lightheadedness already and constipation, and even the meds that you're taking kind of cause like vasodilation and can lower the blood pressure. So it's really important to stay hydrated. That's also another tip I give to all my patients. I say start your day in the morning before you even get up out of bed. Keep about 12 ounces of water next to your bed and just, start the day with the hydrating and, make sure that you are staying hydrated throughout the day. That's very, very important. And then depression and anxiety and apathy are very common. A lot of patients with Parkinson's, just don't want to leave the house, or they don't want to do things they previously liked to do, whether it was socializing or going to a movie or something like that. And it's important to address that, and it's very important to realize it's not you. This is not, you that has become depressed or anxious. This is very much that chemical imbalance in the brain. So it's it's important to be forthcoming if you or your loved one is experiencing mood disturbances, and seek help. We have so many wonderful clinicians that can help and really kind of work on it. So that can occur. Slow thinking is very common. So many patients will describe going to dinner with friends and things like that, and just not being able to keep up with the conversation. But I'm a big believer, and we'll talk about physical exercise, but mental exercise is very, very, very important as well. So these are all things that are important, and we could talk for hours about the different non-motor symptoms. But it is important to be aware that Parkinson's is so much more than just, how am I moving, or am I shaky, or am I slow, or am I stiff? There are many different symptoms that go in there, and unless these non-motor symptoms, the mood, the sleep, the fatigue, the constipation, the urinary issues, unless these are really addressed, it's very hard to have a good quality of life with Parkinson's disease. So definitely bring these up with your provider. And as I mentioned, it is important to see a good clinician. I'm a firm believer. We're very lucky to be in an area of the U.S. where we have movement disorder specialists, particularly ones like Fabio, but to really address your overall symptoms through a good exam, history, and then someone to really help you follow out your clinical course. And how can you take charge of your Parkinson's? Well, this is something I can't stress enough, and this is something that will make a difference. The patient's in the middle, but they have to have this team around them. This is called multidisciplinary care. And again, you have to be your own advocate. For every patient in here that has Parkinson's, really you have to be your own advocate, but you should have all of your advocates around you. The biggest one is family and caregivers. They make it's such a difference. So that's important. The neurologist or movement specialist, kind of the captain of the ship. But use the ancillary services, PT and OT and speech therapy, and we're going to hear from from different programs like dance. We have things, at least in Manhattan, like the Big and Loud and the LSVT, which is speech therapy, and delay the disease. I mean, boxing is something that's really been coming to fruition lately. So there are so many wonderful community resources that can be utilized too. And then obviously you want to make sure that your primary care physician and any other physician you might be seeing are in the loop. There should be a lot of communication between your providers, really, to give you the best level of care. But I cannot stress enough, multidisciplinary care is super important, and you should really look to build your team and carve out your team. These are all going to be your advocates, as well as your caregivers. So work with your team. Again, besides a sleep journal, I really like my patients oftentimes just to journal how they're doing. If they are having that off time, how many hours is it? What are your biggest issues? I tell all my patients prior to coming to see me for a visit, sit down the night before with your loved one or your caregiver or yourself, and write down, what do you want to get out of this visit? What do you want to talk about? What is the most pressing issue? You should never leave an appointment feeling that your questions weren't answered, or that you forgot something, or you wasn't understood. So really be prepared. I think that's very, very important. And just really kind of be forthcoming to yourself as to what are your symptoms and what is bothering you the most. I mean, again, the more communication, the better. I can't stress that enough. And some patients don't want to bring up, especially in front of their spouse, that they are feeling a little low or depressed, or they may be having other symptoms, and that's okay. I mean, I think it's important to at least have that communication with your provider, though. It's very, very important, and be forthcoming. And so it is important to act now. So once we diagnose patients, I believe in really education and implementation of a paradigm. And that doesn't necessarily have to be medication, but it's things like lifestyle. We'll talk about exercise and making sure sleep is okay, and diet, and things like that. So lifestyle modifications are crucial to maintaining your quality of life. And again, you cannot be physically well unless you're mentally well, and vice versa. You can't really be, so to really take charge of your emotional health is so important. And again, there's many ways of doing this through lifestyle measures, but if you are feeling that your emotional health is impacted, it's important to bring up and really, again, carve out that team approach, whether it's a We have some wonderful psychiatrists that are with us on board at Mount Sinai, or psychology or things like that, but it really is important. And there's some other things that are really crucial in terms of managing your PD to live well with Parkinson's disease. Exercise, eating right, finding the right paradigm of medication. I'm, again, a huge proponent of deep brain stimulation. I think it's revolutionized the care of Parkinson's disease. And then, complementary and alternative approach. So it's debatable, but I firmly believe that the only thing that slows the progression of Parkinson's is exercise. I'm a firm believer in that being disease modifying as well as just overall good for your health. I mean, it improves things like balance and flexibility and motor coordination and physical functioning and just overall quality of life. And all exercise is good exercise, and the recommendation is about 30 minutes 5 times a week. If that's possible, and it can be kind of divided if you need to. Again, utilizing a physical therapist to help you come up with an exercise regimen is wonderful, or the dance program, or Big and Loud and things like that. So it's all very good. Also, there's been some evidence of Tai Chi being helpful, and kind of the cycling or resistance training. So again, it is important to implement exercise in some regard, and much of this is a combination of some cardio, gait and balance training, strengthening, and also stretching. That's very, very important. So exercise is really, really important. And I have a lot of patients who will say, well, I really don't have the capacity to exercise, or I've never exercised. Again, find something that you like to do, and you can even do chair-based exercises and things like that if mobility is an issue, but it is crucial to live well with Parkinson's disease. I can't stress that enough. So nutrition is also important. Obviously, you want to maintain, a good weight so that you're not promoting muscle wasting. Many patients with Parkinson's have trouble eating one big meal, so it's really, they feel kind of bloated after, and there's a lot of slow gut motility. So we recommend smaller, more frequent meals, but definitely keep your nutrition up. For women, especially with osteopenia or osteoporosis, the vitamin D and the calcium aspects are very important. And in anyone that is having fluctuations, meaning the on-off fluctuations, oftentimes protein has to be, spaced properly. So again, that is something to bring up with your provider in terms of that protein response. But small, more frequent meals, helping, lots of fiber for the constipation, and also that, and then potentially the protein interaction. And again, it's not up here, but the most crucial thing too with nutrition is hydration. Keeping yourself hydrated. That water is, again, just with exercise, I can't stress that enough as well. We talked about sleep. It's about 60 to 90% of patients have poor sleep in Parkinson's. It's huge. And it's very, very important to bring up, whether it's getting not enough sleep, or having excessive daytime sedation, or having apnea, or the REM disorder again. But it's very, very important to address sleep. You're not going to do well during the day if your sleep is poor at night. That's hands down, very, very important. For those of you who know me or my patients here, I'm a minimalist when it comes to meds. I really don't like to put patients on meds for lots of different things. We try to actually minimize the medication list. But with sleep, that's one thing that I will address if sleep hygiene fails to work, because I think it's so important. You heard a wonderful lecture about the different meds, and I think that the whole key here is there's no two people that are alike, and that means there's no two regimens that are alike, just because patient X is taking one drug, and so everyone has to be very individualized. But the key for my patients is finding the right blend of efficacy and balancing out any type of adverse effects. So it's really a fine line, and you have to individualize each patient according to what their disease looks like, comorbidities, level of psychosocial support, compliance. I mean, these are all real key factors. So, you shouldn't just go to a visit and have your meds doubled. I mean, without thought. Like, there has to be a reason why, changes are made. And I always encourage all of my patients to look at their med list. Oftentimes, patients are on meds that they don't need, or that they were started while in the hospital, or in rehab and just got continued. So you should know everything on your med list as to what you're taking it for, what are the potential adverse effects, why you're taking it, is it forever or is it for short term, and things like that. So really clean up that medication list. I probably spend more time taking patients off meds than I do adding meds, because it's really, really important to really take charge of that. And I think obviously Dr. Denisi follows that approach too. So very, very important to understand your meds. We're going to hear from Dr. Capel about deep brain stimulation, but in my mind, it's the reason I went into movement disorders, it really has revolutionized the treatment of Parkinson's disease and essential tremor through neuromodulation, through kind of fine-tuning these circuits and promoting just more on time. And it's basically using a pacemaker for the brain. It is important for any patient with Parkinson's disease to know, am I a candidate? And so, you should know, are you a candidate and what deep brain stimulation can do for you? But it's really been such a pleasure to work with patients with DBS. So complementary approaches. So I'm a big believer in neuro wellness, and so even though we may not have a lot of data, I encourage all my patients, if you are taking supplements or you have any questions about them, let's talk about it. So we don't have any FDA-approved nutritional supplements right now, but some things that have been talked about are supplements to promote dopamine. One of them is mucuna prurens, which is available in any health store. Fava beans have actually been shown to have lots of dopamine, but my patients will say, I started eating fava beans, and I say, well, you have to eat like 1,000 cans a day to get the dopamine you may need. But that's very interesting. I'm a big believer in vitamin D. I think we're all very deficient. You should know your level, and you should supplement based on that level if you need to. Vitamin D is being linked more and more into different neurological conditions. And so that's very important, potentially vitamin C, E, and folate. There have been some studies with coenzyme Q10 and Parkinson's disease, which have not statistically panned out, although it is helpful and it does promote mitochondrial functioning. So if patients are on it, or they can afford it, or they're on it for cardiac reasons, I'm fine with them staying on that. And then things like acupuncture and massage and things these things can all be implemented well. Parkinson's disease is not just I have Parkinson's, I need to go on medication. It's really, again, creating that team and really taking charge in whatever ways that you can, and potentially these therapies may help you. Again, psychosocial issues and psychological issues are very important. And again, I just want to stress, you cannot be physically well unless you're emotionally well. So if you are feeling that there is any issues with like depression or apathy or anxiety or even hallucinations and things like that, definitely seek help, and there is treatments available. And just education, what you're doing here today, I think is wonderful that you showed up on a Saturday morning, basically taking action through education. Parkinson's is one area that's actually very dynamic and continues to evolve over time, and we have lots of new therapies in the pipeline, and we have better formulations of existing therapies, and we have the lifestyle and things like that. So keep informed. I mean, really, and I can't stress enough, what you learn can help you and your team tailor your therapy. So I like it when patients come to me and they ask about new things, or they ask about supplements, or they ask about this, because again, individualizing and tailoring your therapy is so crucial. Each patient in here should have their own customized plan, and that's very important. There's a lot of good resources as to where to find information. Tiffany can email any of you these websites. A lot of times patients will come in and, of course, Dr. Google, right? They'll put in Parkinson's, and there's so much information, and may not be the right information. So if anyone wants certain resources, these are some of the ones I really like, including the APDA website or the Parkinson's Alliance, and obviously the Michael J. Fox Foundation is very good at potentially for clinical trials and things like that. So one thing I started out at Mount Sinai, we do a monthly patient support group, but I started a caregiver support group because I think there's such an there's a big need for support for caregivers, but caregivers, the role is very, very underestimated, particularly in Parkinson's disease. And it's important for any caregiver in here to realize you're not alone. I mean, 80% of the 12 million people in the US who need support are cared for by a family caregiver. I mean, that's a huge number, especially when caregivers have their own needs too. It could be medical, it could be emotional, and things like that. So if you are a caregiver, it's so important to just take that time out for yourself. Be realistic about the care you can provide. Seek out, friends and support group. I can't stress enough for any caregivers in here, really, patients have to be their own advocates, but they're really only as good as their caregiver, and so it's really important to take good care of themselves. Your role is so important, especially for attending appointments, helping with just, meds and timing of meds, helping to identify symptom changes, but also just regular daily tasks. So, the caregiver aspect is really, like I said, I think it's not always talked about and recognized, but that's something I'm really trying to push as to caregiver emotional health and support. It's really, really important. I can't thank all the caregivers in here enough for everything you do. It's really, really very key and just so helpful. So, there's, again, the lifestyle is so important in Parkinson's. There's not going to be one magic bullet, even if it's deep brain stimulation or the right, amount of levodopa and things like that. Unless lifestyle measures are implemented, I'm not sure you can live well with Parkinson's disease. But if you can, and that's through things, I call it the seeds to living well with Parkinson's. So S stands for sleep, E stands for exercise, the next E stands for eating well, the D is drink water, and the last S is actually socialize. Get out there. When we socialize and we come to things like this, or we meet with friends, or we go to the community groups, we're making so much dopamine, and our neurons are connecting, and it's probably the best form of mental health. So really the socialization aspects are very important. Involve family and friends, have that positive attitude. I think that's very important. And learning about Parkinson's through seminars and through things like that can also be very, very helpful. But again, you have to be your own advocate, but you have to have others that are advocating for you. And hence why I always close on the slide of the multidisciplinary care. So really having that big group around you, patient in the middle, but you should have a team. Build that team. It's very important. And the face of Parkinson's has changed tremendously, whether it's through the advent of levodopa, and then obviously, like I said, deep brain stimulation has been the second advent of revolutionized change. So many promising new approaches under investigation. This is one condition that we do have a lot in the pipeline, but the best way to manage your PD is just stay actively involved, and again, just optimistic and have that team around you. So thank you very much.